I'm eating candy, which is impolite.
And fits into this conversation exactly.
Yeah, really.
Yeah, absolutely. I'm just getting them while I still can, with all the artificial colors and everything.
We should also get our vaccines while we still can. But
Yeah,
that's another,
absolutely. This is Impromptu from Washington Post Opinions, a show that brings you conversations about the news we can't stop thinking about. I'm Charles Lane, Deputy Opinions Editor, and this week we're talking about public health in the next administration. President-elect Trump has nominated Robert F. Kennedy Jr. to head the Department of Health and Human Services. There's a lot to be concerned about with this pick. Kennedy deals in conspiracy theories and misinformation, and at times disregards scientific process. He has said that the USDA and the FDA have an interest in, quote, mass poisoning the American public because they've been captured by the industries they regulated. The list goes on and on. But we want to take this opportunity to talk about America's public health and whether it's possible to disentangle Kennedy's potentially beneficial ideas, perhaps like banning pharmaceutical ads from TV or restricting processed foods for kids, with his unscientific and downright wrong ones. I'm joined by two of my colleagues today to discuss.
Hi, I'm Rob Gebelhoff. I'm a writer and editor here at The Post.
And I'm Leana Wen. I'm a physician and also contributing columnist with The Post.
So, Leana, why don't you start us off? I think we could spend this whole episode talking about the false claims RFK Jr. has made and the conspiracy theories and all the understandable concern that he might dismantle this public health system that's taken so much time to build up. But for just a few minutes today, let's try to talk about any ideas he's mentioned that might have a grain of truth or be worthy of discussion. Is there anything you've heard from Kennedy that fits that description?
Sure. There actually is quite a lot, and I'll go there, but I want to just give the overriding caveat that that's actually the hallmark of someone who peddles in misinformation. That when you look at people who give misinformation, it's not that all that they say are lies. If that's the case, no one's going to listen to them. But instead, you can listen to someone like this, you can nod your head and say, yes, that's right, that's right, that's right. And then you end up going along with the other things that are then said that are actually not right. And so I do want to just put that out there, that even as we're saying, yes, there is truth to some of what he's saying, that is not at all justifying his choice as anyone appropriate to lead HHS. But to your question, Chuck, about what are some specific proposals that do have that kernel of truth, it's that we have an epidemic of childhood obesity in this country. We have an epidemic of chronic diseases in general, and we don't have very good solutions for what to do about this. And so having someone who's taken a fresh look at this, who's not afraid to be disruptive. We know, for example, that ultra-processed food, which make up as much as 60% of the calories that Americans consume, if we're able to cut out ultra-processed food or at least substantially reduce it, that could make a big difference to Americans' health. If we're able to cut out pesticides and also reduce the amount of plastics in the environment, I mean, that's good for the environment, that's good for health. Certainly, that would be an idea worth listening to. But my overall concern with Kennedy isn't so much with this one proposal, or we can nitpick some of the crazy things he said. It's not so much with one particular sentiment. It's that he comes to this as an activist and not a scientist. He has a long history of not abiding by scientific principles, because a scientist does not go in with a fixed point of view and say, that is my perspective. No matter what other facts exist, I'm going to stick to that. That is not what a scientist does. A scientist says, here's my hypothesis, prove me wrong. Or maybe I'll be proven right. Or maybe I'll change my mind with evolving science. But he has not done that. And that's what's so concerning about his appointment, regardless of the fact that some things that he says may have some kernel of truth to it.
Rob, you want to take on the same question?
Yeah, I agree with everything you said, Leana. And, I am also keeping in mind that RFK Jr. is taking over, if he were confirmed, some of the most powerful agencies in the federal government. And I agree with him in the sense that things need to be disrupted. The FDA has a lot of things that are wrong with it. I just don't necessarily believe that he's the person that should be disrupting it. I'm nervous about what happens when he goes in there and decides to fire hundreds of scientists and muddles in the science. I fear that people will leave the industry, and that will make things worse, not better.
So I want to ask Leana to talk just a moment about the column you did the other day in the Post, which was about the seemingly straightforward issue of fluoride in the water, which has been an aspect of public health policy in this country for more than 6 decades. You took a somewhat differentiated view of that. And of course, RFK Jr. has been, I think, outspoken in saying that all fluoridation is terrible. But tell us what people need to know to think carefully about that issue.
Sure. Well, this is not a topic that I knew much about before and actually was not planning to address this topic. But then it was actually Rob, who happens to be my editor, who suggested that I write about this topic. And frankly, I thought this was going to be a really easy column to write. The CDC, the American Academy of Pediatrics, every major medical dental organization says fluoridation in public water supplies is a good idea, that it's safe. I can just look at the research and write a column and be done with it. But I was really stunned by what I found, because I think that there are a couple of things that are true at the same time. So it's definitely true that fluoridation is associated with a dramatic decrease in cavities, especially early on, before the 1970s. The effect now is much smaller now that we have the widespread use of fluoride toothpaste in the US. It is also true that higher levels of fluoride are associated with negative effects, including bone problems, tooth discoloration, and there have even been studies published in quite prestigious journals like JAMA that link brain development in children born to pregnant women who consume higher amounts of fluoride. And so this ends up being quite a nuanced issue because on the one hand, you're weighing a trade-off. You're saying, what is the benefit of continued fluoridation when it comes to preventing cavities? And on the other hand, it really is true that at these higher levels, including some levels that are seen here in the US, you do have these problems. And so I think as a start, it's reasonable for us to re-examine fluoride policy. It's a complex issue. And of all the things that RFK Jr. has said that are really out there and crazy and harmful, this is not one of them. This is an area that really reasonable people should be discussing, should be debating, to be sure. Kennedy says some things that are really not correct. I mean, he's said some things about fluoride that I don't even want to repeat because they're just so bizarre and not based in evidence. But I also think that public health professionals need to hold their fire. They really cannot treat everything like it is the end of the earth. They need to have some nuance in discussing what are the proposals that we can even get behind, for example, around chronic diseases. What are the things that we may not agree 100% around, but are not that bad, for example, removing fluoride? And then what are those things that are truly horrible, for example, questioning the safety and efficacy of measles and polio vaccines?
Rob, Leana has just given us a really good explanation of something where RFK Jr. might be on the right track. In your view, what's his worst idea?
Oh, geez.
And I know you have a lot to choose from here, but you're only allowed to say one.
Well, I guess it would be reducing access to vaccines. We're already seeing a pretty alarming decrease in vaccine uptake among kids. There's a lot more people exempted for getting vaccines for no good reason. I'm very concerned that the next administration is going to double down on its anti-vaccine rhetoric and make that problem worse, which will just cause so many more infectious disease outbreaks that just don't need to happen.
You know what I find tremendously ironic about this is that I think even Trump's worst critics would say the biggest achievement of his first administration was the development of a vaccine for COVID within 9 months. Operation Warp Speed was a huge success. And here he has gotten himself reelected with the support of somebody who thinks that vaccine was a horrible thing. My personal view of RFK Jr.'s worst idea, I have to say, is not in the realm of public health, but in the realm of history. He has been outspoken in support of the view that his father, his assassination was the victim of a conspiracy, as opposed to just the one man who actually did kill him, who was Sirhan Sirhan, and the evidence for that is overwhelming. And sometimes it's useful to take what a person is saying from sort of outside the field, so to speak, that you're talking about as a kind of reality check on how he thinks. Yeah. And to me, I've always found it quite dismaying that RFK Jr. has embraced, alone, I might say, among his family, has embraced that conspiracy theory. Okay, I want to talk about how you all are thinking about covering health issues with the incoming administration after January 20th, but we're first going to have to take a break. Welcome back. I'm Charles Lane, and this is Impromptu. I imagine it is going to be nothing but complicated to cover public health policy and medicine in this next Trump administration. How are you two thinking about how to tackle that task? Let's start with you, Leana.
Well, I've been having conversations with Rob about this, and frankly, I'm not sure how this is going to go. I think a lot of it is a wait and see. And I actually thought that the fluoride story was an interesting test balloon. It was an unexpected test of what this coverage is going to look like. Look, I think we have to be intellectually honest. I think that there are some readers, and we've already seen this, who get very angry if we seem to agree with anything that the new administration is putting out. And they think that, for example, in giving credence to RFK Jr.'s one idea somehow gives credence to all of his ideas. Now, I can understand where they're coming from, but I don't think that that's an intellectually honest approach to take. I think we have to evaluate each proposal as they come along. It may be that there are some proposals that actually are just crazy and bad for health. There may be others that are kind of neutral. And then there may be some that may be a good idea. And look, maybe there are things that a Democratic administration may not have been able to get through, but maybe somehow the Trump administration may be able to get done. And that would be a good thing. My goal is always to approach this writing for the Post as if I'm speaking to my patients. If my patients came in and asked about fluoride, what would I say to them? If they came in and asked about ultra-processed food, what would I say to them? I would always base my answers on research, on science. If I don't know the answer, I will look it up. If the answer's changed because of new research, I'll say that. And I think that that's what our readers deserve and expect is the truth. But I am really curious to hear what Rob
Well, I am
this.
too, because ultimately he's going to decide what gets printed here because he's your editor. How do you feel about that, Rob?
I 100% agree with you, Leana. And, we have to be fair. We need to be balanced, but we also just need to be honest with people. It's not that everything is going to be a five-alarm fire, and that's okay to acknowledge that.
Well, I think it was really important what you were saying before, Leana, about the fact that a person who's as radical and offbeat as this is sort of bound, like the proverbial stop clock, he's going to be right twice a day, and that you have to disentangle that part of the message. Another thing I think that we all are going to have to keep a close eye on is what is realistically possible to change anyway. He makes all kinds of statements like, I'm going to fire all the people at the FDA. Well, there is this thing called the civil service and their protections, and you can't just fire people overnight. Among other reasons, they'll take you to court. There's a huge, and this is part of what he's protesting against, I guess, there is this huge bureaucracy that moves very slowly. And, lots of people come to Washington saying, by God, I'm going to change everything overnight. And then by the time they're gone, they're defending the existing system. So I think that's another important distinction that we're all going to have to maintain is what are the things that are really within his control to change quickly and what are not. So the last thing I want to go into with you guys is really something that is not necessarily particularly about RFK Jr. or even this administration. But if you could argue for just one policy change, only one, that would actually make America healthier, what would it be? I'll start with you, Rob.
Well, I do think one of the biggest issues in the health sphere that we could fix is to empower the food division of the FDA to better regulate the industry that it is supposed to be overseeing. That is a decades-long problem, and it is a serious issue. I mean, trans fats were banned in 2015. And it is the only time that the FDA has used its mandatory powers to get rid of a substance from food. And that took about I don't know, 20 years to actually happen. And that was after decades before then, scientists were talking about this as an issue. This is just ridiculous. And I'd love to give the food division more authority, more resources to do these sorts of things, because that's what we really need to be focusing on.
Leana?
My answer is exercise. When you look at a single intervention that has the biggest impact on mortality, on cancer, on cardiovascular disease, second to none, it's exercise. People who exercise for the recommended amount by the CDC, which is 150 minutes per week, 31% lower risk of dying from any cause, 29% lower risk of dying from cardiovascular disease, 15% lower risk of dying from cancer. Even half of that amount, which is just 11 minutes a day, will also substantially reduce your mortality. I mean, there's no single medication that matches that. Even cutting out things from food, which I certainly agree, we need healthier diets, but even changing your diet or getting better sleep or nothing else matches this amount of benefit that you derive from exercise. And so maybe there are things that could be done to, not to mandate exercise, of course, but to make it a lot easier for people to exercise. And whether they are from worker protections or whether they're in communities making walking paths more accessible, I would love to see that as the type of policy change that perhaps even RFK Jr. can get behind as something that could really make Americans healthy.
So I have one, I don't know how much healthier it would make America, but I also think there are certain things the federal government does that it should stop doing. I think there's a whole category like that. And one of them is the fact that people can use their Supplemental Nutrition Assistance Program benefits to buy candy, soda, and other snack foods that are not only ultra-processed, but laden with sugar and obesogenic. I think that since the program is labeled a nutrition program, the government, in the role of paying for it, should have the right to make sure that it's real nutrition that the taxpayers are supporting. And that's one that's been bandied about on the Hill over the years, but that I think actually might get some traction as we're starting to rethink all these issues. So I just gave myself the last word. I have a habit of doing that when I host these shows. But I also
Chuck,
did.
Can I add one thing?
You just did.
To your last word?
You just did. Go ahead.
Okay. I wrote a couple of columns about this last year and discovered that Rob and I have an opposing point of view on this topic.
I
and
know.
So,
Well, that's why I had the last word, because I didn't want to give Rob the opportunity to oppose me. I mean, I understand there are people who say people are entitled to choose, right? Or we don't want to convey a message that there's some sort of stigma associated with getting these benefits. But, I think we're already a little bit pregnant on that, because you don't allow this to be used for wine and beer. You don't allow these benefits to be used for tobacco and a couple of other things. I think it would convey a strong message from the federal government too. I mean, if I had more time, I would go on and on about the fact that the entire agriculture department's budget is, a massive subsidy to an obesogenic diet, right? But that one little thing as a discrete policy change is something I'd like to see.
Chuck, it's funny that you mentioned that people who are on SNAP can't buy alcohol, tobacco, et cetera, which is totally true. But what we don't see is, because of that policy, those people drink less alcohol or use less tobacco. In fact, they probably drink more and use more tobacco. It's a subsidy, and money is fungible. Therefore, if you give any money to people to buy their groceries, they're going to use that money to buy what they can, and then the leftover money, or the money that they would have used for groceries, they can spend on other things. So in general, I just don't think it will have that much of an effect. And in fact, it might hurt.
So I was wrong.
No, Chuck, I agree with you. I think you have a program that's supposed to be about nutritious food. I think it's a misuse of the program, and it's inconsistent with its goal. If you use food assistance to do something that's totally destroys nutritional health or flies in the face of nutritional health. And then the public ends up paying for it twice. You end up paying for it by tax dollars to subsidize these unhealthy foods. And then you pay for it because individuals then have a higher rate of obesity and diabetes. But I hear the other side. Rob and I have had spirited conversations about this. I still think that, though, if Kennedy or somebody else were to propose this as a reform, that's the kind of policy that I don't think we should jump up and down about, because it's something that divides even the public health community as well, in the same way that Rob and I have opposing views.
So I will retract that sentence where I said I was wrong, and I would add that let's not kid ourselves about the lobbying and the grocery industry money that gets spread around among think tanks and so on that is devoted to preventing reforms like this, because I think they feel like it's a slippery slope, that the minute you get the government interested in restraining this, what I call the incumbent American diet, who knows where that would lead. But again, I think when you're talking about the taxpayers supporting something that's intended to promote consumption of food, candy, soda, and so forth doesn't belong. Well, on that note, thank you, Rob and Leana, for joining me on this episode of Impromptu.
Thank you.
Before you go, here's a quick word from our humor columnist, Alexandra Petri.
Okay, look. I think putting RFK Jr. in charge of the Department of Health and Human Services is just like checking a box that says, do you want to increase preventable deaths for no reason? Insofar as he has any ideas at all that are not abjectly bad, you have to wade through such a morass of nonsense to get to them that you'd be better off getting those ideas from almost literally any other source. It's like saying, I hear there are edible muffins in the back of the fridge at this hoarder house full of dog feces and cockroaches. It's like, okay, let's get muffins anywhere else. Let's get muffins somewhere where we won't have to shove our way past a partially digested whale carcass. This man told supporters recently that he wants to give infectious disease a break. You know what I don't want to do? Give infectious disease a break. That sounds like a bad idea. I am not an expert, but I know I'm not an expert, which I think Socrates said was the beginning of expertise. RFK Jr. has not reached that point. The only thing, and I hesitate to even say this because it will sound like there's something I think should be allowed health-wise that currently isn't because they're keeping us down, but the only thing is, I think if archaeologists find really old food somewhere, they should be allowed to eat it if they want. Like when they found the cherry preserves at Mount Vernon, George Washington's estate, or the really old honey on a dig in Egypt. I think they should be allowed to have a little taste if they want. Or if they don't want, maybe RFK will volunteer. He's eaten weirder things. And then at least he could use his position to tell us something fun and useful, like how the ancient honey tastes, rather than just increasing the likelihood that our kids will get horribly sick from a preventable disease.
This episode was produced by Hadley Robinson, edited by Damir Marusic, Chris Sulentrop, and Allison Michaels, and mixed by Emma Munger. Chris Rucan designed our art. Special thanks to Millie Mitra and Deirdre Byrne. Thanks for listening to Impromptu. As always, send us your feedback at impromptu@washpost.com. And if you're liking the show, please rate us and leave us a review on your favorite podcast app.